is Julia. I'm a student nurse from Oakland University, and today I checked the physician's order, and you're going to be needing an NG tube insertion, but we'll talk more about that later, okay? I also saw that you were NPO. Is that correct? Okay, great. Can you just confirm your name with me? I'm going to check your wristband. Okay, and then what about your date of birth? Okay, awesome. So just give me a minute. I'm going to close the curtain for privacy, and I'm going to perform hand hygiene. Okay. I'm just going to ask you a couple questions to start off. Do you have any allergies I should know about? Okay. When was your last bowel movement? Okay. Do you have a history of any deviated septum? Do you have a deviated septum? Okay. Do you have any respiratory diseases that I should know about or issues? Okay. Have you had any nausea or vomiting recently? Okay. So now I'm going to go ahead. I'm just going to listen to your abdominal sounds. Then I'm going to palpate and percuss. I'm going to listen to your respiratory sounds. Listen to your lungs, see how those are going. Now I'm just going to lower down the railing. I'm going to raise your bedding to the high Fowler's position. I have a basin placed here for you to use if you throw up. And then I'm just going to put on my gloves. And then I have a towel that I'm going to place on your chest so you don't get any secretions on yourself. So here's that towel. Okay, so now that we're all set up with that, I'm just going to explain the procedure. So what's going to happen is I'm going to take up the nasogastric tube. I'm going to measure from your nose to your ear to your xiphoid process. And then when I insert the tube, I'm going to put it back to your nasopharynx, rotate it 180 degrees, and then put it down your throat. When it's going down your throat, just swallow, okay? Okay. So there's one last thing I have to assess for. I'm just going to check your nares and make sure that they're patent. So I'm going to shine my light up there. Okay. Can you plug your left nair for me and breathe in and out with your right? Okay, and do the same thing with your right. Okay, great. So it seems like both nostrils are patent, but it seems like the right one is just a little more patent, so we'll use that for the procedure. So now I'm going to go ahead and I'm going to take out my nasogastric tube. I'm going to take the lube out and then put it on the packaging. So I'm going to take the end of it and I'm going to put it up by your nair. I'm going to put it by the tragus. Then I'm going to take the nasogastric tube down to your xiphoid process and then put it 2 inches over. So it looks like the length that you need is 50. So I'm going to mark that. So now that that's all marked, I'm going to dip the nasogastric tube in 3 to 4 inches of lube. And again, so you're going to extend your neck up, and I'm going to put it to the back of your nasopharynx. We're going to rotate it. You're going to put your head forward, and then you're going to swallow, swallow, swallow like you're drinking water. Okay? You may gag. It's typically a very uncomfortable procedure, but just relax and listen to the sound of my voice. Okay? Okay? So I'm inserting the tube to the back of the nasopharynx, rotating it 180 degrees. Can you just flex your head forward now? Okay, and then swallow, 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 swallow. Okay, great. So during this process, I would check that I would look in the back of the patient's throat and make sure that the nasogastric tube didn't get coiled up in the oropharynx. I would also assess the patient for respiratory issues such as gagging and potentially vomiting. So now that the tube is hooked up there, I'm going to tape it to the patient's cheek as a temporary placement. In the meantime, I'm going to call the doctor. We're going to get a chest x-ray, make sure the tube is in the right place. We don't want it in the lungs, we want it in the stomach. Another thing I could do is check for aspirate. So I would put the syringe to the white lumen, the clear lumen, pull out some gastric aspirate. I could put that on a gastric card and check the pH, and then check that the gastric secretions are the yellowish fluid that comes from the stomach typically. So once we go back, we get the physician's okay to go ahead and continue, knowing that it's in the right place. I'm going to correctly tape it to the patient's nose. So to do that, We're gonna rip the tape up like pants, fold the edges over so there's like little tags. I'm gonna stick it the top part to the patient's nose, stick one pant leg to the tube, and then wrap the other leg around the nasogastric tube. Once that's all set like that, I'm gonna hook up the nasogastric tube to suction. So the blue pigtail lumen is used for decompression. This right here, I'm pretending it's a reflex valve with the blue end inserted into this. So this is for decompression. We're hooking this up to suction, the other lumen to suction, low intermittent. Otherwise, then I'm going to listen to the patient's respiratory sound and see if there's any crackles or rhonchi, because we don't want fluid in the lungs. I'm also going to assess their comfort. So, how are you feeling? How are you doing? I'm going to make sure the head of the bed is above 30 degrees. And then I'm just going to do documentation. So I'm going to document what time I inserted the nasogastric tube, the inches at which, on the tube at which I taped it to the patient's nose. I'm going to document that we got that it was in the correct placement, and then any secretions that are released from the tube. So after I've done all that, I'm going to raise the railing of the bed, make sure the bed's in the lowest position, get rid of my gloves, and then I'm going to go about my day. So I'm going to come back. Make sure the patient has the call light. Can I come in? Hi, I'm Julia. You saw me yesterday. I'm a student nurse from Oakland University. Today we have a physician's order to irrigate your NG tube, but first can I just confirm your name? Okay, and then what about your date of birth? Okay, thank you. So to irrigate your nasogastric tube, the first thing I'm going to do is I'm going to assess your vital signs. So I'm going to get your vital signs. Can you tell me your last bowel movement, if you had one? Okay, have you been having any nausea or vomiting? Okay, awesome. So now I'm going to disconnect you from suction, making sure to clamp my finger over the tube. So now that we've done that, I'm just going to first check this is in the right placement. So I'm going to take my syringe, hook it up to the clear lumen, and pull out any gastric content. Once I see that there's gastric content, I'm just going to push that right back in, pull out my syringe, and cover it. So now I'm going to take some sterile water, and I'm going to pull out 30 milliliters of fluid. Then I'm going to push that into the tube. From there, I'm going to aspirate. So I'm going to pull out as much aspiration or as much aspirate as I can. So I'm getting 40 milliliters of fluid. The fact that I have 40 milliliters of fluid and I inserted 30 means that there's 10 milliliters of gastric secretions. So I'm going to note that for documentation later. I'm going to push it all back in. Now I'm going to hook the reflex valve up to the other lumen and set this down, and I'm going to get a new clean syringe. Then I'm going to fill up the syringe with 10 cc's of air. And I'm just going to go ahead and I'm going to pump 10 cc's of air into the blue lumen just to check for patency. And then I'm going to close that up. So now I'm just going to go ahead and I'm going to hook you back up to suction and make sure that's all set. And then from there, I'm going to document the solution we used, so the 30 milliliters of sterile water. The input was 30 milliliters of sterile water. The output was 40 milliliters, but the actual gastric aspirate was just 10 milliliters. We irrigated at a specific time, and I'm just going to assess your condition, and then I'm going to raise the railing, lower the bed, give you your call light, and then I'm going to come back. Another thing I don't know if I said, but when I came in here, I would have performed hand hygiene, closed the curtain, and put on fresh gloves. Okay, so I'm coming back, and then I'm coming back in the next day. I'm confirming the patient's name, date of birth, closing the curtain, performing hand hygiene, and then I'm just going to talk to the patient a little bit. So, good news. So we got an order from your physician to remove the nasogastric tube. Isn't that great? Yeah. So have you been having any gas in the past 24 hours? Okay, good, good. So for removing the nasogastric tube, what we're gonna do is, so I'm gonna push some air through the tube just to make sure there's no more fluid in the tube. Then when I pull it out, you're gonna tilt your head forward a little bit and you're gonna hold your breath. Does that sound okay? Okay, great. So I'm just making sure the bed's in the high Fowler's position, lowering the railing. So then I'm going to detach this tube from suction. I don't need to check that it's in the right placement like I did for the first two procedures. So I'm going to take 20 cc's of air into my syringe, and I'm just going to go ahead and I'm going to push that through the tube to make sure that that's cleared out. So now I'm going to go ahead and I'm going to clamp the tube. Okay. So now I'm going to have you tilt your head forward, and when I pull it out, I want you to hold your breath. That's going to keep any fluid from going into your lungs, okay? Okay, are you ready? 3, 2, 1. Okay, I'm pulling the tube out. Okay, so I'm checking the bottom of the nasogastric tube. It's intact and there's no blood on it. And then I'm just going to go ahead and I'm going to dispose of that in the proper location. So now that I've disposed of it in the proper location, I'm going to listen to the patient's lung sounds to make sure that there's no aspirate in the lungs. So then I'm going to, one thing that I would have done before removing the nasogastric tube is remove the tape from the patient's nose. So now I would go ahead and I would take soapy water and I would just clean off the patient's nose. And then I would ask them, you know, do you need any tissues? Can I clean off your mouth for you? Is there anything else you need? How are you feeling? And then from there, after assessing all of those things, I would document them. So I would say, you know, the nasogastric tube was removed at this time. The patient's condition is good. The patient tolerated the procedure well. Make sure they're feeling okay. The respiratory sounds were clear. Then I'm going to lower the bed to the lowest level, raise up the railing, give the call light, and then I'm going to throw out all of the equipment that was used and then dispose of my gloves. And then that'll be the end of it. Thank you.